Dr. Summer Nourse. I teach Nursing 309, the Adult Health Assessment course. In this course, we learn how to do a full head-to-toe assessment on a patient. In this course, we also get to use a lot of fun equipment. So I've got Sam here to help me demonstrate how to listen to heart sounds and lung sounds, which you guys will get to practice on at some point. So we'll go ahead and kind of learn how to auscultate heart and lungs with your stethoscope. So when you're listening with your stethoscope, you want to make sure that you're using the big part, the diaphragm, when you're listening to the lungs, the breath sounds, or the heart sounds. So when we're listening to heart sounds, the first thing we want to do, there's 4 valve areas that you want to listen to. So this is going to be the aortic. And here you can hear the heart sounds audibly. So we're listening for the lub-dub, lub-dub. Then listen on the left side for the pulmonic valve. Move down to the tricuspid area. And then we're listening for the mitral valve. So when you're listening to heart sounds, you want to listen in those 4 areas. Listen for that lub-dub, lub-dub, and note whether the heart rate is regular or irregular. So this one has a really good pattern. We're going to say it's a regular heart rate. And next I'm going to show you how to listen to the breath sounds. So let's stop this one. And here's what some normal breath sounds would sound like. They're a little bit quiet for this video. When you're listening to the lungs, again, you want to use the big part of your stethoscope. And we're going to start up here at the top on the front, so up near the clavicles, and then work our way down. We're going to listen for 1 full inhalation and exhalation before we move to the next side. And those are the anterior breath sounds. Now we're going to listen posteriorly on the back side. So we're going to start up at the top again, go side to side, and work our way down. So after listening to Sam's lungs, it sounds like he has clear breath sounds in all lobes, bilaterally, anteriorly, posteriorly, and laterally. So his lungs sound nice and clear. So you can actually listen with your stethoscope and hear the breath sounds if we exit out the speaker. So you can't hear them now as you would before, but you can still hear them when you're actually listening with your stethoscope. So it gives you good practice with your own stethoscope as well. So that's how we do a heart assessment and a lung assessment.